Welcome to week 13. Our content is unit 11 in your ebook. It is genitourinary and reproductive function, covering chapters 39, 40, and 41. And you'll be happy when you hear what I want you to focus on and what I will ask you to overlook in those chapters. We only have 2 more weeks after this week of content, and then we have our course 4 exam and the final. If any of you have concerns about your grade and how it's averaging out, you should be able to see a percentage over on the far side of your grade book in Canvas. And that is your percentage that you've achieved for the points that have been available to you so far. So if any of you are landing under the 70% mark or dangerously around the 70% mark, and you want to send out an email to me about what you need to be doing to ensure your success in this program, in this course with a passing grade. And I'll tell you right now how I'm going to respond. I'm going to ask you about some activities that you've been doing within the course. For instance, have you been watching the focus videos every week? Have you been doing chapter prep you quizzes? I just, finished inputting the grades for the 3rd course exam, and when I go in there, I can see all of the student activity for Prep U, and I have to say that in most cases, the students that are getting the high grades on those exams are the ones that are also doing lots of activity within Prep U. And those who are struggling with their exam scores seem to be doing no extra Prep U quizzes. So I think that might be part of a recipe for success. It's not too late. Don't forget that after your course 4 exam, which will be on just the most recent content, you're also going to have a final exam. Final exam is 75 questions on all course material. So it's never too late to be getting into Prep U and taking some of those self-exams. Also, a reminder that you have your last case study 5, which is on sexually transmitted infections, or STDs as we call them. Now the lingo is STIs, for sexually transmitted infection, which is what they really are, is infections. So you have your last case study. I'll tell you right now, it's on syphilis. Sometimes if you read through the whole case study, at the end you actually might have a clearer picture of what it's about. So do read through. I would encourage you to read through the whole case study before you start to respond to the individual questions, because that will get you more focused on which direction this patient is going. So let's get into chapter 39, disorders of the male genitourinary system. And if you start out in chapter 39, you'll see it starts with a figure 39-1, which overviews the structures of the male anatomy, basically the testes, the scrotum, the genital ducts, the accessory organs, and the penis, their location and function. Take a look at that figure. And then also do look at the table 39-1, or I think it's labeled chart 39-1, about the functions of testosterone, which is the primary male hormone that it relates to reproductive and sexual function in the male. Then you drop all the way down. There's a lot of disorders that are coming up in this chapter that we're going to breeze over. My focus is to narrow it down to some of those disorders that are clinically relevant, meaning we're not preparing you to work in a doctor's office necessarily or work in a urologist's office, but to be nurses in a hospital setting. And we're going to focus on the disorders that we are more likely to see in a hospital setting. And one of those disorders is priapism. That'll be further into the chapter when you're looking at disorders related to the penis. That is a continuous erection lasting greater than 4 hours. That is considered a medical emergency. And should that happen, it can happen to people of all ages. It can happen to children as well as adults. Sometimes it is in correlation with the patient taking erectile dysfunction medication. But no matter the cause, it is considered an emergency because it is a vascular situation in the penis that can result in tissue damage if it's not treated. So any erection lasting greater than 4 hours, that patient needs to be transported to the emergency room for some intervention. Then go all the way down. You can skip over disorders of scrotum and testes, go all the way down to disorders of the prostate. This is what brings a lot of people into a hospital setting, both from a medical perspective as well as a surgical perspective. So I do want you to read about acute bacterial prostatitis, and then your big focus in this area is going to be on benign prostatic hypertrophy, or hyperplasia as your book calls it, BPH. And this is sometimes considered a precursor for prostate cancer, which of course is a huge concern for most males of a certain age. But BPH is common enough that they say 50-year-olds, about 50% of 50-year-olds will have BPH, about 60% of 60-year-olds, 70% of 70-year-olds. So as you advance in age, more likely you are to have issues with, basically it's an enlarged prostate. And why that becomes an issue is the prostate, you'll see in the diagrams, if you look at figures 39-11 and 39-12, the prostate encircles the urethra. So the enlargement of the prostate then becomes a problem for the urinary tract and the patient's ability to empty their bladder, which becomes a huge, big problem. Then also I do want you to read, so I want you to read everything there is in the book about BPH, and then also move on to prostate cancer and look at figure 39-12. Read about what are the clinical features, how do we screen, because as a nurse you're going to become an authority on when should some of these screenings take place, at what age, and what are the expected findings. So do read about the screening for prostate cancer, how we make that diagnosis, and then what is the relationship between prostate cancer and BPH. That's it for the chapter on male. Now let's move to female. Female, there's a few more disorders we're going to take a look at, but you'll start with the structure and function of the female reproductive system, and that's figures 40-1 and 40-2. Take a look at the graphic of the uterus. Know that there are 3 layers to the uterus. And also take a look at the ovaries and the functions of the ovaries, looking at figure 40-4. Then just like I want you to know what are the functions of testosterone, I also want you to look at the table about the functions of the female side, which is estrogen and progesterone. And that is table 40-1. And we're going to skip over a few things and we'll go on to cervical cancer. And that is all the way on to page 1029. So read about the causes, the pathology, the prevention of cervical cancer, how do we make that diagnosis, and how is it treated. Another female disorder we want to look at here is PID, pelvic inflammatory disease. Take a look at figure 40-9. Another disorder, endometriosis. Endometriosis. You can skip over endometriitis. You can look at it if you like. But the big one I want you to look at is endometriosis. And there's figures 40-10 that talk about all the different locations that endometriosis can land and why this is an important disorder. What are the siliquae of endometriosis? Then reading further down to page 1033, what happens when the pelvic floor starts to fail? There are all these female organs, the bladder, the uterus, the rectum, etc., all kind of balancing on the ligaments of the pelvic floor. What happens when the pelvic floor starts to fail? So I do want you to read about those disorders of cystocele, rectocele, enterocele, and uterine prolapse. And if you look at figure 40-13b, you'll see the locations of all those problems and the surgical interventions that are required in most cases. Then moving on, a couple more disorders. One is ovarian cancer. What is the incidence, the types, the risk factors for ovarian cancer? How is that diagnosed? What's the clinical presentation? Because the ovaries cannot really be visualized typically during any kind of an exam, this is a very difficult cancer to catch. And therefore, I believe the mortality does go up slightly with ovarian cancer. That's on page 1036. And so take a look at figure 40-16 related to ovarian cancer. Then we'll move on to staying in female, the disorder of breasts and breast cancer, the risk factors for breast cancer. The reason I focus on some of these is this is what nurses are expected to know related to patient teaching. Like, how do you teach a patient, male or female, how to screen for some of these disorders? How can they be responsible for their own sexual health? So what are the risk factors for breast cancer and the importance of breast exam? And what are the recommendations for mammography, which is currently our kind of gold standard as far as diagnosing breast cancer? And that is on page 1044. Take a look at figure 40-19 for information that you'll be responsible for related to breast cancer. That's it for our females. Now we're going on to sexually transmitted infections or diseases. And there are many of these. We're going to focus on a few. The biggest ones, the main ones that we tend to see and that people need to know about. We start out chapter 41 with a discussion on page 1050 of HPV, human papillomavirus. 360 million people, in the country, in our country, just our country, are the carriers of HPV. So read about HPV and what kind of a risk factor that is, how is it diagnosed. We now know there's a vaccine, obviously, for over a decade now we've had a vaccine that is effective against most strains of HPV. So take a look at that. Inform yourself if you don't already know. You're going to be a nurse, so people are going to expect that you'll have current and proper information about HPV and that vaccine. Moving on to genital herpes, as it relates to herpes simplex virus, you'll read that there are two, herpes simplex 1, herpes simplex 2, and we used to think of only one kind of herpes simplex as the genital herpes variety, but now we know that both varieties of herpes simplex can actually cross over and become related to our sexual organs. Yeast infections, candidiasis, I'm not sure if I'm pronouncing that, but it's related to candida. And we think of that as a secondary infection very often when females are put on antibiotics for any various reason. They will, within a few days, develop a yeast infection. Sometimes it is candidiasis. So do read about that so you'll understand how a patient is diagnosed with it, what predisposes them to it, and then what kind of intervention we do for that particular disorder. And then we're going to close off this chapter with the big three: chlamydia, gonorrhea, and syphilis. And those have been around for a long, long time. And unfortunately, they're still out there, and people do still get them. And most of these sexually transmitted diseases can be eradicated to some extent by practicing safe sex or by using protection during sex. So take a look at that and think of yourself as a kind of a public service announcement for some of these disorders that you as a nurse should have, again, current and correct information and be able to inform your patients on how to protect themselves and then what to do should these symptoms occur. For this, I'd like you to look at figures 41-6 and 41-7. This chapter in particular, 41, is full of some very gross pictures. Usually we see graphics And there are some interesting graphics in this chapter, as well as actual photos of various sexually transmitted diseases. Those are gross to look at, but once you take a look at them, they'll make an impression. It'll help you inform your patients, I think. So let me know if you have any questions about these chapters. Don't forget you have that final case study due on sexually transmitted. I'll be back with you next week. Thanks.